Welcome, and thank you for joining us today for the CE module provided by the Center for Behavioral Emergency and Addiction Research at the University of Texas Health Science Center in Houston. This session is designed for professionals who work with youth and is focused on high-potency synthetic opioids, often called HPSOs. We'll explore what they are, the risks that they pose, and how you can help protect both yourself and the communities that you serve. Here's an overview of what we'll cover in this session. First, we'll go over what opioids are, including the difference between natural and synthetic types. Then, we'll explore high-potency synthetic opioids, or HPSOs, and then what makes them uniquely dangerous. Next, we'll discuss exposure routes and overdose risk across different age groups, especially infants, children, and adolescents. We'll close with practical strategies for overdose response, including how to use naloxone and how to educate youth using harm reduction approaches.
Opioids are natural semi-synthetic or synthetic chemicals that bind to opioid receptors in the body and the brain, reducing the sensation of pain. Although the term opioids and opiates are sometimes used interchangeably, opiates specifically refer to natural compounds from the poppy plant, like heroin or morphine, while opioids can be natural or lab-made. Natural and semi-synthetic opioids includes drugs such as morphine, codeine, hydrocodone, and oxycodone. When a person ingests an opioid, it binds to receptors in the brain, leading to effects such as pain relief, euphoria, and the potential for dependency, withdrawal, and addiction. In medicine, when opioid medications are properly regulated and monitored, they can effectively manage pain while minimizing the risk of addiction and misuse. This applies for patients using opioids for pain relief or as part of a medication-assisted treatment program such as mood.
HPSOs are synthetic opioids that are more powerful than other types of opioids. In medical settings, they are mainly used to manage severe pain, but their high strength also increases the risk of addiction. HPSOs can also be made and sold illegally. Right now, the biggest concern for children welfare is fentanyl and similar drugs. Fentanyl is the most common HPSO on the illegal drug market. It can be made into pills or sold as powder. Since synthetic fentanyl is much cheaper to produce, it has become the most widespread HPSO in the United States. The physical effects of opioids include relaxation, pain relief, and euphoria, but they can also cause sedation, confusion, dizziness, nausea, vomiting, urinary retention, pinpointed pupils, and most dangerously, slowed or stopped breathing. Respiratory depression is the primary cause of death in opioid overdoses. A little note on nitazenes. Nitazenes are powerful lab-made opioids with no approved medical use. They are potentially 40 times stronger than fentanyl and are difficult to detect through standard drug tests or test strips. Knowing overdose symptoms and having naloxone readily available, we can then implement harm reduction practices, and through these practices can reduce the risks that are associated with nitazene use and help save lives. Illicit fentanyl, it varies in strength because it is unregulated. This makes it especially risky since even a tiny amount can be lethal. The danger is even greater for children and toddlers who have no tolerance and smaller bodies. This makes them extremely vulnerable to fatal overdoses from even trace exposure. Drug poisoning or overdose deaths can result from taking too much of a drug, receiving the wrong drug, or even accidentally ingesting a substance without realizing it. Over the past 2 decades, overdose deaths in the United States have risen dramatically, with synthetic opioids driving much of this increase. Drug poisoning deaths, as defined by the CDC, includes deaths resulting from unintentional or intentional overdose of a drug. being given the wrong drug, or taking a drug in error, or taking a drug inadvertently. Children are at risk here because they can inadvertently get their hands on a drug and accidentally ingest it, which would be considered drug poisoning. HPSOs can come in 3 different forms, such as pills, powders, or transdermal patches. With the pills, they can be swallowed, crushed, smoked, snorted, or injected. In pill form, they are available as prescribed medications or also available on the illicit drug market. Powdered forms of illicit fentanyl can be smoked, snorted, or injected. And then medically prescribed fentanyl is available in transdermal patches. These are specifically designed to be absorbed by the skin.
Fentanyl is also sold under names like Fetty, China White, Dance Fever, and even Lollipop. This makes it hard to recognize and increases the risk of accidental ingestion. Fentanyl and its analogs can enter the body through various methods, each with different risks and effects. Here's how they are typically used. Fentanyl powder can be snorted through the nose. This method allows the drug to quickly enter the bloodstream via the nasal mucosa. It is a common route for users who prefer not to inject. Fentanyl can be smoked, often mixed with other substances such as marijuana or crack cocaine. Smoking allows the drug to rapidly enter the bloodstream through the lungs. Fentanyl is sometimes pressed into counterfeit pills that look like prescription medications, such as oxycodone. These pills are ingested orally. They can be highly dangerous because users may not know they are consuming fentanyl, which can lead to overdose. Fentanyl can be dissolved into a liquid and absorbed onto blotter paper, which is then dried and cut into small squares. Users may ingest or place the paper on their tongue. This method is less common, but it has been reported. Fentanyl is available in transdermal patches, such as those used for chronic pain management. These patches release fentanyl slowly through the skin into the bloodstream over a period of time. Fentanyl is often sold alone or mixed with other substances, including heroin, cocaine, or, as we mentioned, counterfeit pills. Combining fentanyl with other drugs can increase the risk of overdose due to the unpredictable potency and interactions. Fentanyl is frequently found in counterfeit pills which mimic prescription opioids like oxycodone, hydrocodone, or alprazolam. Users might be unaware that these counterfeit pills contain fentanyl, significantly increasing the risk of overdose. Each method of ingestion carries unique risks, and fentanyl's high potency means that even a small amount can lead to a fatal overdose. Fentanyl in pill or powder form is not readily absorbed by the skin if touched. Ingestion can carry a higher risk of overdose, following by snorting and smoking. Taking illicit manufactured HPSOs by mouth also carries a risk of overdose because the strength of the opioid in the pill is unregulated and unknown. The risk of overdose, while including opioids, including HPSOs and moods as directed by a medical provider, is low.
In 2024, the DEA has seized a record of 79.5 million fentanyl pills. This figure surpasses the total of 58 million pills seized in the previous year. Laboratory testing reveals that 7 out of every 10 fentanyl pills seized by the DEA contains a dose of fentanyl that is potentially lethal. This really underscores the high risk associated with illicit fentanyl pills and highlights the severe danger that they possess to users. There are no confirmed cases of overdose from touching fentanyl powder or pills. These substances do not absorb easily through the skin. Prescription patches, however, are the exception, as they are designed for skin absorption. There's also no evidence that secondhand smoke from fentanyl causes overdose, though the long-term effects of environmental exposure currently are unknown.
The following guidance was developed to assist Washington juvenile courts in evaluating the impact of high-potency synthetic opioids on child safety. For the purposes of this guidance, child safety is defined as the risk of overdose that could result in fatality or near fatality. A comprehensive literature review was conducted to understand current recommendations. Although much of the public literature lacks discussion on illicit HPSOs affecting children and youth, Washington state overdose data shows an increase in deaths related to HPSOs starting in 2018. Washington is among the first states to pass legislation addressing HPSOs as a unique factor in child abuse and neglect cases. These guidelines represent the first public health guidelines focused on HPSOs for court consideration in child placement decisions. The guidance is based on literature related to HPSOs, related overdose deaths in children and adolescents, expert opinions, and Washington state data, including death certificates. This guidance is considered preliminary and will be updated as new public health research and community discussions develop.
Children below age 5 are at the highest risk for unintentional exposure to any substance, particularly opioids, with the highest risk falling around age 2. Children in this age group explore their surroundings actively to discover things, and they're putting things in their mouth, right? Additionally, children who have not taken opioids do not have any tolerance built up, which also increases their overdose risk. Middle childhood, ages from 5 to 12, have the lowest risk of accidental or intentional exposure to opioids. Children in this age group are generally past the developmental milestone of exploratory behavior and have not reached the developmental milestone of adolescence, where we see more experimentation and risk. So although this is a low risk factor age group, children do reach developmental milestones at their own pace. So risk can't necessarily be determined solely based on numerical age. The adolescent age group is typically exposed through intentional experimentation with substances. 2/3 of adolescent overdose occur in a youth's home. Often there's another person there who didn't know the youth was using opioids. Teens experimenting with substances is different than small children who accidentally swallow a substance. Caregivers and professionals must use different ways to prevent teens from overdosing, which does include reducing naive exposure to opioids through prescription medication. While most teen substance use interventions focus on prevention, a harm reduction approach is also warranted. Harm reduction can help youth engage in developmentally normal risk-taking behaviors to do so with more knowledge and capacity to engage in safe practices. These strategies should be shared with teens, regardless of whether they say they and or their friends are using substances, as some might not be forthright about this experimentation. Universally providing naloxone and harm reduction education will ensure that those at risk will have needed access to life-saving practices. Like adults, adolescents 15 and over experience opioid use disorder and can benefit from medications for opioid use disorder. The Young Heroes program in Houston offers OUD support for adolescents aged 13 and over, as well as for adults, and this does include mood when it's appropriate. Opioids act on the brain by binding to opioid receptors. This blocks pain signals and increases dopamine, leading to feelings of pleasure and relaxation. Over time, repeated use disrupts the brain's natural reward system, driving dependence and increasing the risk of addiction. When too many opioid receptors are activated, breathing can slow down or stop. This is the primary mechanism of an opioid overdose. Naloxone plays a critical role here by knocking opioids off the receptors and allowing normal breathing to resume.
Fentanyl overdose requires immediate medical attention. Call emergency services and consider administering naloxone if available. Be aware that symptoms can escalate rapidly, and quick intervention is crucial to prevent serious complications or deaths. Key signs of opioid overdose include slow or stopped breathing, pinpoint pupils, extreme drowsiness or unconsciousness, blue or gray lips and fingertips, nausea, vomiting, choking or gurgling sounds, cold, clammy skin, or seizures. If you notice these symptoms, act quickly.
If you encounter someone experiencing an overdose, call 911 immediately. Know your location and cross streets and tell dispatch you have someone unresponsive. Try to wake them by calling their name or using a sternal rub. Check for and clear away any substances or paraphernalia. Administer naloxone or Narcan if available. Remember, lay, spray, and stay. If needed, repeat naloxone every 2 to 5 minutes. Provide chest compressions or rescue breathing if they're not breathing. Once they are breathing again, place them on their side in the recovery position and stay with them until EMS arrives. Naloxone is an opioid antagonist. This means that it binds to the opioid receptors without activating them. It blocks the opioids from attaching to the receptors, which reverses their effects. This allows normal breathing to return. Naloxone works within minutes, though multiple doses might be necessary when a high-potency opioid like fentanyl was taken. It's safe to use even in children or during pregnancy and cannot cause an overdose. Naloxone typically lasts 30 to 90 minutes. Because fentanyl can outlast it, medical follow-up is always essential after administration. Withdrawal symptoms may occur in opioid-dependent individuals, but naloxone itself has no abuse potential. Remember, it only works on opioid overdoses, not those caused solely by alcohol or benzodiazepines. Naloxone is safe to use in adults, adolescents, and children. Naloxone use is relatively safe in pregnancy and can save the lives of both the person who is pregnant and the fetus. Naloxone is safe for infants and children when given to a breast or chest feeding parent. Teaching parents how to administer naloxone in the case of accidental ingestion could help prevent fatal overdoses. Welfare workers are uniquely situated to be able to provide this life-saving medication and teaching on how and when to use it. So how do we handle naloxone nasal spray? You want to hold the spray with your thumb on the bottom of the plunger and place your index and middle fingers on the side of the nozzle. The phrase lay, spray, and stay can help you remember what to do if you need to administer naloxone. You want to lay the person on their back, spray naloxone into one nostril. Stay with them until emergency responders arrive. This simple protocol can save a life. Do call 911 for assistance. Do attend to the person's breathing and cardiovascular support needs by administering oxygen or performing rescue breathing and/or chest compressions. Do administer naloxone and utilize a second dose if no response to the first dose. Do put the person in the recovery position on their side if you must leave the person unattended for any reason. Do stay with the person and keep them warm. Don't give food or drinks or any other substances. Don't put the person in a bath or a shower. Don't try to make the person vomit drugs. Don't inject the person with anything, and don't leave them alone. Remember, your calm, quick action does matter. The Young Heroes program offers a range of services for youth aged 13 through 17 who are dependent on substances and ready for change. Services include assessment with a pediatric nurse practitioner, medications for opioid use disorder if eligible, peer recovery support and coaching, unlimited individual counseling with a licensed chemical dependency counselor. Youth may qualify with parent or guardian consent. Our phone number here is listed, 833-696-5102, or you can visit us at go.uth.edu/youngheroes for more information. Thank you so much for participating in today's CE. Here are some additional references for further information.